Revenue Cycle Management from NPS, leaders in technology solutions for physicians, and a member of the Perfect Practice Alliance. As the newest addition to our suite of healthcare enterprise solutions, National Physician Services presents NPS Revenue Cycle Management, or RCM. A well-designed RCM system is able to communicate with the EHR and financial systems to streamline the billing and collection cycles and maximize cash flow. Once upon a time, the healthcare revenue cycle was considered to be a back-end billing function. In today's environment, and particularly with the implementation of ICD-10, the revenue cycle is dynamic, heavily regulated, and continually changing. So the NPS RCM service begins by asking a simple question. Is your practice revenue cycle ready? In other words, are you prepared with the technology and processes in place to manage your practice's billing and financial health? As conversion to the new coding system continues and accelerates, almost every aspect of your practice's RCM will be impacted, including many IT systems that rely on diagnostic, analytic, and procedural information. In other words, your practice will have to closely examine the changes to process, people, and technology that need to be made to comply. Let's start at the front end, where you first meet your patient. Here, you will need to reconfigure your process for case and utilization management, patient eligibility, and medical necessity. Payer-specific reimbursement verification will have to be restructured to meet ICD-10. Your practice will need to start at the beginning by retooling contract management. Mid-cycle is where the specificity of ICD-10 documentation has created a real challenge for providers. Charge capture and proper coding are critical at this phase. Low accuracy rates in rollout programs and a need to get the right technology in place and the right training on how to use it all have demanded a tremendous amount of energy and investment from physician practices, time that's often taken from patient care. Finally, at the back end of the revenue cycle, billing, cash collections, and reimbursements, processes will need to be aligned for increased demands in contract and denials management, revenue analytics, rate modeling and forecasting, and most of all, your practice will need to have the right staff, the right process, and the right RCM system in place to pull everything together at this final stage. So, how can NPS help? Because we're part of the Perfect Practice Alliance, we can bring you a full range of integrated services that work together to get your practice's revenue cycle management program initiated, improved, or fine-tuned. Working with our trusted and proven partner, Convergent Solutions Incorporated, NPS bundles leading RCM solutions with our physician-driven data services to achieve major revenue enhancements for our clients. NPS offers proven revenue cycle management services that will help you create and implement an effective action plan. Specifically, we offer custom workflow processes and systems designed to ensure optimal charge and resource capture, proprietary rules-based charge processes tailored to your practice's coding and reimbursement business rules, expert ICD-10 CPT certified coding, provider and staff training, comprehensive fee analysis and payment verification to ensure contract compliance, provider enrollment and credentialing, analytics services designed to ensure data availability for key decision points. Contact us today for a free initial RCM discovery and assessment discussion. Your practice can't afford to wait.